I studied Chinese medicine in 1969, before I finished veterinary science. I finished veterinary science in 1974. I'm trained in Chinese medicine, TCM, acupuncture. So after I graduated, I went into teaching, would you believe it? So I did a diploma in education. I was teaching nursing and zookeeping and stuff like that. And then later on, I became a clinical nutritionist. And I thought I wasn't going to work with animals. I think I'll start with people. But that was very short-lived. After I graduated, I went to a hospital to do clinical nutrition. In Asia, food is your god. It is. So clinical nutritionists, we have no room to play where food becomes your god. Food should be your home, should be your friend. But food rules you, unfortunately. Good or bad, well, you'll soon see. I'm going to talk, the first of my talk is about nutrition for health. Years ago, when I started work as a veterinary surgeon, I decided to come back here. I went to Singapore because Singapore, the reason I went there was because Singapore is one of the few countries in the world where Asians can showcase their skills. And me as a veterinarian, when I was in Australia, veterinarians had a lot of trouble showcasing their skills because in Australia is an agriculture country. You have a dog that is sick, you tell the owner this is going to cost you $700 or $1,000. They say, well, you know, sorry, I'm going to take it out of the bag, I'm going to shoot it, I'm going to replace another dog. That's the Australian. A dog to them is a dog. So now in Singapore, we like to believe we're leaders in veterinary science. We have 4D ultrasound, MRIs, all sorts of things. We're doing open heart surgery, if you're interested. As of September this year, we'll be the first clinic in Asia to do open heart surgery. So there's a long way to go, but 80% of my practice is not that. 80% of my practice is actually nutritional medicine. We do a lot of nutritional medicine because I believe that without nutritional medicine, you can't get an animal to be well, because we forget one thing that I never learned at university, that the patient heals itself. We are just there to help. We forget that. And we think, well, you know, it's the doctor that heals the patient. No. You've got to remember, patients can heal themselves. And to allow the patient to heal themselves, you have to provide them with the right environment. What's the right environment? The owner and food and good drinking water. You don't have that, no matter what you do, the patient is not going to go and get well. So the environment is extremely important. You are what you eat. You are. The longest living people in the world are Southern Russians, Northern Chinese, and Japanese. Lifespan for an average Japanese from Hokkaido, 100? 90 to 100, average lifespan? No, that's long. The short lifespans are Southeast Asians. You have very short lifespans. You don't have a long lifespan. And I don't mean 70 years old, hooked up to a drip on a respirator. That's not life, huh? I mean working, mental capabilities, all okay. That's, to me, life. Where do you find these people? Not in America, that's for sure. Where things are still very basic. Where they get good drinking water. Where they get good food, fresh food. So what about our dogs and cats? What do they get? They get chlorinated water out of the tap. They eat the food that you eat, or worse still, it comes in a bag. And as veterinarians, when I first graduated, I was taught dogs should all be eating dry dog food because it's complete. When I learned clinical nutrition, I discovered that's a wrong term to use. It is not complete. There is no such thing as a complete dog food found in a bag. If you could show me, I'm talking about, I'm the person to design addiction. I'm not going to call that food complete. It's not complete. At best, balanced, not complete. Because the minute you put food through an oven, you bake it, you process it at 200 to 300 degrees centigrade. I mean, who cooks around here? Most of you, right? Malaysians all cook. When you bake something, what's the oven temperature? Usually 180, right? Use 160, 180. The oven in my manufacturing plant is 200 to 300 degrees centigrade. So the food goes, all your meats, everything go in, comes out in about 15, 20 minutes, half an hour. It's dry. Wow, that's got to be a hell of a high temperature. Huh? So what are we feeding our animals? How should we approach the topic of nutrition? When I was at university, my nutritional lectures for dogs and cats, 1 week maybe, and really it's not about disease, it's about vitamins and minerals and stuff like that, which doesn't really help me. Because if you were to go to a doctor and say, what should I eat? You know the reply from most doctors and vets? Feed it a balanced diet. Then the next question you should ask the doctor, then what is a balanced diet? When people tell you about a balanced diet, but they themselves really don't know. When you really question them, go and talk to a vet one day. Ask him to help you design a balanced diet. He's going to have a lot of trouble, you know, because we never learned. This is a dog with bloat. Stomach is full of gas. We see this in big dogs a lot. We see that in Asia. We see it in Singapore, these German Shepherds and all. And when I was at uni, even now, people tell you, bloat, oh, deep-chested dogs get that. I know deep-chested dogs get that, but why? Why? Oh, dry dog food or soya bean or exercising too fast after a meal or drinking too much water or not giving enough water. That's rubbish, actually. The reason why dogs get bloat, you never read it in a book. This is a form of food allergy. It's a food intolerance that develop bloat. Because if you treat this dog surgically, take out all the gas and all that, and then you stitch up the stomach so it doesn't roll over, which we were taught to do, which is actually so terribly wrong. And then a question came into my mind one day, how come you don't really see bloat in the wild? I'm not talking about sheep and cattle that eats commercial diet and all that. But wild animals, the deep-chested one like cheetahs and all that, don't suddenly one day wind up with bloat and they blow up. They don't. And animals on fresh food seldom ever develop gastric dilatation. Bloat is a very common condition amongst dogs on commercial diet. Even if you feed scraps to a dog, they seldom develop bloat. Huh? But the minute you put them on dry dog food, canned dog foods, all of this, they develop bloat. It's got nothing to do with the consistency. It's actually what's in there, what's inside the food. The 6 best doctors anywhere in the world, and no one can deny that, huh? Sunshine, water, rest, air, exercise, and diet, in that order. Top is sunshine. Do you know they did a survey of people over 45, 50 in the US? Life Extension did that survey. They found that 68% or 70% of most adults are vitamin D deficient. You know why? Because you don't go out into the sun. You manufacture vitamin D in your skin. You don't have enough sun. And China women, probably all of them are deficient in vitamin D because nobody wants to have any sun. Everybody wants to look like Caucasian. Asians want to look like Caucasian. Or Caucasians go to tanning salons to look like us. It's really weird. But we want to be white. When you get white, what happens? You're vitamin D deficient. So what happens when you're vitamin D deficient, or you sit indoors in the aircon all the time, or you're in your house, you never go out, you don't play sports, you don't go to the sun. I'm not talking about sun tanning. That's stupid, okay? I'm not talking about, but at least some sun. What happens is you do not produce vitamin D. But what is vitamin D used for? We'll talk about that later. Very important vitamin D that I reckon, if I was to do a survey, probably 70-80% of you are vitamin D deficient. Animals need sun. You don't believe it? You have to look at the birds outside, the miners and all. You know, when the sun comes out, They lie down, you think they're dead. They spread out and they lie in the sun to catch as much sun, and they spread the wings so that they get maximum surface area. They're not sun tanning. They're getting the ultraviolet so they can, and the infrared and the far red so they can produce vitamin D. An important source of vitamin D is sunlight. What happens when you're vitamin D deficient? Lack of vitamin D leads to abnormal absorption of calcium. People think, oh, you know, the doctor say, drink your milk. You know, you're 45, you're going to get soft bones. Drink milk. But you drink milk, your bones are still soft. In fact, softer. If you go to Europe, you go to America, most people over 50 are osteoporotic, but they eat so much milk. They got so much calcium. They take cheese. Everything in America has cheese in it. There's not, even if you're going to eat a bowl of porridge, some idiot is going to come along and put cheese on it. So you're going to have cheese. You get milk. So people say, you know, Dr. Lai, you know what you're talking about. Really? You're going to have a look. Most Americans and Europeans and Caucasians, by the time they're in their 50s and 60s, they are wheelchair bound, or they're in a nursing home and they walk with a frame. They have a lot of trouble, and they really look their age. So why? Us Asians, in the old days, we never drank milk. I don't like milk. I don't drink milk. I drink soy. So I'm 64 this year. I don't walk with a wheelchair. I'm not osteoporotic. In fact, my bones are really soft, really hard. When a dog bites me, the dog has trouble. I've been bitten so many times. It really breaks the teeth, you know. I'm really firm. I don't drink milk, but I go into the sun a lot. I love sports. And then they found out in Singapore last year that the doctors were wrong giving calcium tablets to women. Because all you do with calcium, you increase your heart attacks. You increase heart attack when you take too much calcium tablets, because you can't absorb it, or it's not soluble, and it goes, you know where? To your arteries. Or it goes out through your kidneys. Or it goes out through your stools, and your stools get very hard. You're not utilizing it properly because you're vitamin D deficient. So now the recommendation by doctors as of last year, you need to check whether the patient is D3 deficient. And then they start checking, yes, they are. If you don't give vitamin D, you're wasting your calcium. In fact, there is enough calcium in the food you eat, more than enough. Low vitamin D leads to poor immune system. Maybe that's why Southeast Asians die so early. Your immune system sucks. A lot of you will have cancer. 2.5 people, 1 out of 2.5 will have cancer in Singapore or Malaysia in the next 10 years. If I look at this audience, that means 2/3 of you, 1/3 of you will have cancer in the next 10 years. Scary, but that's true, or you're going to have a heart attack. So people say, I don't want to live that long. You know, when you get to my age, I don't talk like that anymore. When I was young, I'm not going to live that long, you know. I'm just going to have a good time, right? And young people always talk like that. I'm going to have a good time. I don't really want to live that long. Hey, listen, you wait till you're in the late 50s, 60s, 70s. I want to live a long time, you know. I'm really enjoying my life, you know. Then there's one thing we never talk about when we go to nutrition lectures. Water. Nobody talks about water. Who heard people talking about water when you go to a lecture? Anybody heard someone talking about water? Maybe unless you go to a water lecture, nobody talks about water. But people forget water is a nutrient. Did you know that? Google, look at nutrients. Water is a nutrient. It's the most important nutrient. I'm just so sad Addiction doesn't sell water. Actually, we should. We should marketing water as our first nutrient because it is very important. What does water do? It's a universal solvent. Everything must dissolve in water. You can't just eat food and not drink water. It will dilute and protect you. If you take 1 cup of salt, you're going to have serious problem. But if you take water with it, You drink loads of Chinese tea or water or whatever, you're flushing it out. It protects your system. If you take some of the foods that we eat, you take chili powder, you take 1 teaspoon of chili powder, you don't drink water. Wow, I tell you, it will rot your gut. It facilitates metabolism. Your body cannot function. Chemical reactions in your body cannot occur without water. Detox. Your body needs to have water to detox because it's flushing. You need to flush out. Your bile is rubbish. Your urine is rubbish. Your stools are rubbish. Ooh, imagine you have no water trying to go to the toilet. Wow, it's going to be like rocks coming out. People don't realize that, but you know that water is an antioxidant. Not all water is an antioxidant, but water can be made into an antioxidant. Did you know that? You didn't. Do you know water and water is different? Water in the mountain is different to the water of your tap, which is different to the rain, which is different to the sea, which is different to the rivers. It's all water. You can filter out all the rubbish in it, but it's different. It is different. How is water, because water also carries memory. Wow, people say, how can water carry memory? It does. Water can carry memory. Do you know when they started doing organ transplantation 20 years ago, 30 years ago? Getting more advanced now. You can do a heart lung transplant. You can do a hand transplant. You can take all sorts of organs and start transplanting them. And then they found similar stories. People who receive organs suddenly will develop memories of the person who donated that organ. You don't know that person, but you will develop these cravings. You develop these tastes for things. You see things. How come? You don't know who the donor is. They wrote books on this. They made movies about that. The scientists cannot understand it. It is not in the genes because the genes doesn't carry this kind of memory. It's short-term memory, but it's in the water. That's where the memory is. It's in the fluid. This is called cellular memory. The water in the cells carry this memory. It does. I'll explain to you in a minute. It becomes very clear. This is science. This is not voodoo medicine. As an essential nutrient, the animal's body is 90% water. As you get older, 70 and 50%. A lot of people my age have only about 50, 60% water. They're very dry. Their skin is dry. Mine is not because I drink a lot of water. And the disc starts to shrink. Your spinal disc starts to dehydrate. So what happened to these people? They start to shrink. You notice that? My friends, one of my good friends, James Tan, he's a vet in Singapore. He was taller than me. He's 73, 74 now. He's now like this. They shrink because the discs shrink. Each disc is about 1 cm. About 1 cm. When it shrinks another half of that, imagine half a cm, you multiply the number of discs in the spinal cord. That's a lot of inches, a lot of cm you're going to shrink. So you will shrink if you don't have enough water. The body fluids or water can carry information. This is called cellular memory. All water have a charge. You can alter this charge. Nature can alter it. For example, after a rain, especially when there's a storm cloud, a lot of lightning and thunder, and you hear a lot of thunder, you see a lot of lightning, the water that comes down has a different taste because it is charged. It's negatively charged water. That water is fantastic water. You put it on your orchid, you look at the orchid, then you put tap water on the orchid. Same orchid, you watch them grow, different. Or you put fish inside rainwater. In the old days, we used to collect rainwater, right? Or now it's not. People don't do it, it's illegal in Singapore, but you know, that water is fantastic.